What is one of the biggest reasons people fail to reach their goals after a total hip or knee replacement? In the next 5 minutes, I'm going to show you how to avoid one of the biggest mistakes people make that keep them from getting the best results after surgery. And if you'd like to know more about how we can help you get the best results, comment yes below, and I'll send you an invite for a free 15-minute call with me to talk about the best way to help you get back to the lifestyle you want. I'm Brad Logan, founder of Total Joint PT, and I'm your telehealth physical therapy specialist for total hip and knee replacement. I've successfully helped thousands of people online to rehab their new joint after surgery, and in every video, I'm going to give you one tip or strategy you can use to get the best possible results. All right, this is one of the biggest reasons people fail to reach their goals after a total hip or knee replacement. They get too aggressive with physical therapy too early, and then they drop out of therapy too soon when they would benefit the most. And why is that not working? Because it's out of sync with what your new joint needs as you progress through the phases of healing. By getting aggressive too early in the rehab, you're not giving your body time to clean up the damaged tissue and lay the framework to rebuild. During the first several weeks, exercise should be more basic. So if you're doing too much too soon, you're going to cause more inflammation than necessary, as well as more pain, higher risk of things like infection, hematoma, scar tissue, or other complication that leads to a major setback. Then, people tend to drop out of PT around the 6 to 8 week mark for several reasons. They may have reached the end of their insurance benefits, they may have to go back to work and can't fit PT into a busy work schedule, they may just get tired of driving to a PT clinic 2 to 3 times per week, or a combination of all of these. But the 6 week mark is when people really benefit from more aggressive PT the most, because your new joint has now established a strong foundation of healing where it can tolerate more aggressive activity. So if you start too early and then drop out too soon, you're not giving your new joint what it needs for the best results at the time it will benefit the most. To get the best results, you have to start slow and then build up to more aggressive levels so your new joint has the opportunity to go through the phases of healing. During the first few weeks, you're in the inflammatory phase where your body is cleaning up all the damaged tissue and laying a framework for the new tissue to rebuild. This is the most painful phase of your healing, but your body needs to have a chance to effectively go through this phase. If you're doing too much activity at this time, then you're damaging that new framework because it's not strong enough to tolerate normal activity yet. If you're pushing too hard and keep breaking down this weaker framework that your body's trying to build, then it has to keep clearing up newly damaged tissue, and you'll stay in this inflammation phase longer than necessary, which can lead to more pain, more swelling, and more scar tissue formation that limits your final results. During this phase, the exercise should be basic, like range of motion, muscle activation, light strengthening, and walking. Next, you move on to the rebuilding phase. At first, the new cells start to fill in randomly to make a larger framework before it can start to build a more organized matrix of cells. It's appropriate to start ramping up your exercises to a moderate level during this phase, but you can still overdo it. Activity that's too aggressive during this phase can still break down the new tissue trying to form, and then again, you're stuck in that pattern of rebuilding along with that chronic inflammation. But if you do the right exercises, your body can move on to the remodeling phase. This is when it's time to ramp things up. The tissue is now strong enough to handle more aggressive exercises at this point and needs the appropriate program to get back to full strength and function. Unfortunately, this is when many people drop out of their therapy, so they miss the phase when more aggressive exercises have the most benefit. By starting slow and ramping up appropriately, you're giving your new joint what it needs at the right time to allow it to heal properly. I know it's tough to hold back, especially when you start to feel good, because the mindset might be, the harder I work this, the faster it's going to improve. Some people get away with it, but for every story I hear about someone who played golf at 4 weeks after surgery without any issues, I have 20 other stories about people who had a major setback. So give yourself permission to take it slow at first. Give your new joint a chance to heal, and you'll set yourself up for much better success when it's time to ramp up. And that's exactly what we do in our Total Joint Jumpstart program. The right exercises at the right time you can access online, anytime, anywhere, to give your new joint exactly what it needs through each stage of the healing process. You can do all of these exercises at home or at the gym on your schedule with live online appointments with a real physical therapist to make sure you're on track to meet your goals. If you'd like to know more about how we can help you get the best results after surgery, comment yes below, and I'll send you an invite for a free 15-minute call with me to talk about the best way to help you get back to the lifestyle you want.